Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing a couple of Medicare assistance programs that can make a huge difference for you and your agency and the people you serve in procuring and keeping business. Very hectic time during AEP. This is a program that gives you an additional exposure to different folks, but it's also a piece that goes beyond the Medicare business, and we'll touch upon that in a couple of places within the presentation. This presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. And you'll notice in the software package, there's a section for both questions and chat. We ask that you put your questions in the questions box. We find that we cover the vast majority of them through the course of the presentation, but we want to make certain we address any inquiries that you have regarding these programs. A couple of other things as well. There is a presentation for the public that we will go through toward the end of today's presentation. It will be made available to you through your Premier Marketing Agent Success Manager, your marketer that you deal with. If you're not working with someone at this point in time, we'll make certain that you receive the information and the expertise of the folks that help you utilize it. Since we do have a spread of agents that visit us on these webinars with different experiences with us and with other organizations, a little bit of level set about who Premier Marketing is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. There are offices across the country. We're licensed in all 50 states. We act as an insurance wholesaler through independent insurance agents such as yourself, with contracts available at the highest possible commission levels and recruiting contracts available to those who qualify. We do so through a full portfolio of products. So the base programs that you have to address the Medicare health insurance needs, the Medicare Advantage, Medicare Supplement, standalone Part D drug programs are there for you, but also a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits that address specific needs for the folks that you serve. We speak to the entire portfolio because of some of the things that you do in your fact finding with these assistance programs can positively affect your performance and your production in other areas as well. And that includes these Medicare Advantage plans where the national carriers are available to you through our organization, along with many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the standalone prescription drug programs, where the majority of these are part of the MA contract with the named carrier, a couple of exceptions. The Mutual of Omaha program is a separate contract from their other programs and deals just with their standalone prescription drug plan. And Clever RX is actually a discount program and not a Part D plan. In the Medicare supplement arena, we have a full portfolio of products here as well. And as you deal with the Medicare supplement market, you inevitably work with or speak to the Part D programs. So today's program will have a bearing upon how some of these programs work for you as well. Those ancillary products I mentioned in each of the categories, national leaders are available to you through the program, the programs that we offer, and we find that they are very helpful in marketing opportunities, additional marketing opportunities, not to mention additional revenue for ourselves and our agencies, but most importantly, it addresses those specific needs that folks have in these areas. So when we look at the Medicare market, you don't come on a program like today without hearing of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. Well, that is tempered a little bit by an increasing number of people who are not accessing all their Medicare benefits when they are first eligible. So that number is skewed a little bit when you look at age above, but it's also skewed back up with the age below. And these are the folks that are under the age of 65 accessing Medicare benefits because of disability. And these folks are, in many instances, a key market for the dissemination of information on these assistance programs. Can make a huge difference for you. This is a portion of the population that's difficult to market to because, hey, how do you identify them in any type of outreach? But it also then gives you that opportunity that as you serve these people in each of the categories, they're going to talk about you to other people who are in similar circumstances. So it really increases your odds of good referrals coming to you. So in each of those choices, we want to make certain that we're aware of the numbers of these assistance programs. So if people don't do anything additional from Medicare, but perhaps a Part D plan, or if they pick up a modified, or pardon me, a modernized Medicare supplement program, well, that's part of the deal too. And then of course the Medicare Advantage programs with the embedded drug programs that are part of many of the MAPD, Medicare Advantage prescription drug plans, they all need information about these programs. And we'll find out specifically when we look at the portion of the population that, hey, about half of it will probably qualify for some of these programs. So we can make a big difference with the folks that we visit with, not only in enrolling them in programs that we offer, but also keeping them, but then taking that information and going beyond that initial enrollment, making them a true client by getting referrals and using some of the information that we glean from these programs to speak to them about other parts of programs they need for their future. And we'll talk about that in detail in just a moment. So we see in the initial enrollment of folks when they come into Medicare, it's a pretty even split between Medicare Advantage and Medigap programs, skewing a little bit up here lately with the Medicare Advantage plans. Pandemic had something to do with it. The aging of the baby boomers more comfortable with a managed care program has something to do with it. Number of other reasons, whatever they may happen to be. Hopefully it's not the 9 million commercials we see on television that just confuse people. But once again, in each of these categories, we have folks that can be positively affected by these programs, and it just takes a little bit of time on our part. We also want to make certain that we properly communicate with the folks that we're visiting with, specifically through the use of acronyms. There are a lot of folks out there that, well, you get used to it. You know, AEP, we say that all the time. You know, even Joe Namath on TV is telling people it's the annual election period. We're not speaking to something that confuses people. We want to make certain that they understand what we're speaking of. And we can see there, hey, there's a heck of a list, 4,220 off the CMS website. So we want to make certain that we're defining what we speak to, and particularly when we get into the use of and the description of these assistance programs, we got to be really certain that folks understand how these programs come about and how they affect themselves as an individual, and how that can also be transferred to other members of their family and friends. We're right in the midst of the annual election period, which occurs every year from October 15th to December 7th. These programs that we speak to today can make a huge difference in any of the standard election program or periods that we have, and also the different special election periods that are out there that enable us to work year-round. Because some of the things that we'll encounter now as we visit with folks for the annual election period, well, those plans don't take place, they don't take effect until the first of the year. We don't get paid until after the first of the year. If they qualify for a SEP and there's a more appropriate program in place for them, well, it's October, we still have an 11/1 and a 12/1 effective date that we can help them. And the use of these programs can help create that special election period now. And we examine their programs for not only 2022 because of our use of these programs, but also solidify their choice for 2023. Heck, they're coming up with all kinds of special election periods as well. It's really important for us to keep in mind that a lot of times, if we're talking to our clients year over year, we're doing an annual review for the most part, but the majority of people on Medicare are not. So a lot of the fresh acquaintances that you make through this time period hadn't done a review of their program last year. So that's why, one of the reasons why the special election period that these programs can create can make a huge difference for them now. Why would that be important? Well, gee, we're in the latter part of the year. Folks are maybe a little cash dry, shall we put it? And these can really help them with the cost of their prescriptions and other expenses as we go through and examine them, and make a big difference, regardless of their choice of base medical coverage. They stayed on traditional Medicare, self-insured, or picked up a Med Sup, or if they went into the bundling of a Medicare Advantage plan, either way, we can help them now and moving into 2023. And when we speak of the folks that are particularly affected by this, we're looking at the folks that are particularly vulnerable. And you can see through this graphic given to us or supplied to us through the Kaiser Family Foundation, it speaks to how this affects people in all ages and all race, ethnicity, and education levels. But we see that some of the folks that are particularly vulnerable when it comes to dollars, they are the ones that really need our help. Many of them will have these programs in place. Some of them will not. So having some base numbers can make a huge difference on how we approach people, because if it's in an embedded drug program as part of an MAPD plan or part of a standalone drug program, and once again, emphasizing this fact, they need our help, and they're not finding it on their own. They're not using the government resources, even the packages that are sent to them, you know, the Medicare and You handbook, if it's sent by United States Postal Service, or if they're delivering it electronically. If they're reading it, they're not doing anything about it. They're not using some of the tools that are there, and we want to make certain that we can help them realize there are ways to make their Medicare more affordable, and we can help them through the use of these programs and our expertise on the plans that this enables us to enroll them in once that is in play. And we're able to do it in a couple of different ways. Obviously, when we work with marketing organizations or carriers or whatever it happens to be, the folks that help us help people, we want to make certain that they have the power behind them to deliver information in the manner that's best received by our prospects and clients. Some folks still want the hammer and chisel and the stone slab. You want to see them in person, you got to shake hands and kiss babies across the kitchen table. Well, that's fine. That's the way we deliver it. There are folks, however, that want to be totally virtual. Just email me that stuff. I'll do the shopping. And a whole lot of folks are shopping more than they have been in the past. What we want to make certain that is if we're doing a hybrid situation as well, in any of these opportunities, we're delivering the information in the manner in which the person wants to receive it, but we're also being compliant with it. And that's why systems can make a big difference, particularly when you're dealing with information like we talk about today that has a whole lot of numbers in it. And we want to make certain that folks understand exactly what's going on. And they're getting better at it, they being the folks we visit with, because, well, they're being trained by all aspects of society. The pandemic has put everybody in a little bit of a different world. Now, we're not as shut down as we used to be, but there are still a lot of providers that are delivering appointments virtually. And that includes primary care doctors, specialists, hospitals, dentists, even folks celebrate their faith virtually as well. So we have a group of folks that are being trained to do, to be delivered information on an electronic basis. And if we have that capability, it can make a huge difference. So speaking specifically, I'm going to check here real quick. And yes, this is being recorded and you will have access to it on our website and on our YouTube channel. We want to make certain that we realize that the marketplace going into 2023, well, there's a whole lot of activity out there. There's a whole lot of plans out there. And as an agent, we sometimes pick and choose the programs that we're comfortable with or that we feel most effective. And we may not have contracts with everybody in the world. That little disclaimer that the government has us preach now on telephone conversations saying, I don't represent every plan that's available. Well, you don't need to necessarily. And in some cases, there are some programs that don't work with the broker channel. So you can't. But in these circumstances, all of these programs can be superseded, in a manner of speaking, by the use of these programs. And the programs I'm referring to are the Extra Help and the MSP programs. LIS, MSP. Let's throw some more acronyms out there, John. The Low Income Subsidy for the medications, the Medicare Savings Plans for other expenses. And so we want to make certain that we're able to deliver a maximum benefit regardless of the portfolio that we offer and what's being available in our target market. One of the things we want to look at as well is this. There's an increase, seems every year, on special needs plans going up, a number of programs that are available. And the majority of them that are being offered are usually either a DSNP, a dual special needs program, or a CSNP, a chronic special needs program. In each of those cases, the use of assistance for prescriptions or other costs can make a huge difference as to how you can market in that area moving forward. And in certain circumstances with the dual special needs plans, those MSPs are a necessity in order to maximize the benefit of these plans. So there's a ton of them out there. So what do? Well, you look at carriers that can deliver for you. You see the big boys out there banging their drums every year, doing very well in many circumstances. The star ratings that have come out here recently have changed perception on some folks a little bit. And there are other carriers that are out there saying, hey, I've got a 5-star plan. Talk to me. That may make a difference for you. And that may make a difference not only because of the programs that are out there, the availability, but the carriers then may also have marketing support for you that enables you to reach into this market through the use of these programs. So what's the value of them? Plain and simple. If you have folks that are going to qualify for a low income subsidy extra help program, it's going to maximize their plan benefits. It's going to minimize choices they have to make and the costs that come with them. It can create that special election period. Now, during this time period, not so much, because it's the special election periods for these programs are once a quarter. And in the fourth quarter, we go into the annual election piece of it. But there are folks out there that don't have coverages now and they need help now. So that's something we need to do. It can affect it can and does affect the cost of the plan, the copays that are applicable in the program, any co-insurance or coverage gap programs, and possibly even the catastrophic coverage cost. And it can affect previous enrollment penalties. Remember, because if a person doesn't enroll when they're first eligible, they get whacked with that 1% per month of the national average until they have a plan. You have someone that goes into this subsidized program, the Part D LIS program, it takes care of that penalty. It is important to note that it doesn't affect some of the machinations within the plan itself. So the drug list stays the same. So we still need to do an evaluation of their medications and the programs that are out there. It doesn't affect the plan's requirements for step therapy or quantity limits. So we want to be aware of that and have that in our mind to properly communicate when we visit with folks. It does, however, increase our prospect pool greatly because, well, we tend to hang out with people that are kind of like us, and it gives us the opportunity to do additional marketing just through the use of the best marketing tool out there, which is the use of referrals. So it'll get us in front of a whole bunch of other people. It's also important to note that as we do this, we're doing what's best for our prospect. We're making it harder for anyone else to replace our product, not only because we've maximized benefits, but because we've taken that extra step and we've created a loyalty with that enrollee through the use of these programs. It does and can create a program that may have lesser benefits, bring it up to par, or perhaps increase it because it affects the copays and all the other costs that come as part of their current drug program or any other one that they enroll in. We talked about the special election period it can create. It gives us an opportunity too to manage our time, because as we run through the folks that we visit with, we're looking at how do we schedule folks to minimize windshield time or create a virtual event in order to visit with them. Using this program as that entree into the market, you can take one person, one lead, and grow it into many, and it helps you then because you're presenting to multiple individuals and making maximum use of your time. As I mentioned, these folks, when you help them, then you have a higher likelihood of a referral because, hey, you really helped me. My cousin Joe down the street is in a similar situation. You need to visit with him. Let me give him a call. That's a great way. And it also gives you an opportunity to deal with a population that has a little bit different mindset than a full dual. There are some folks out there that say, I don't want to deal with the Medicare, Medicaid beneficiary. They feel they get everything for free now as it is. Well, some do have that attitude, some do not. But the folks that have a need for and qualify for help on their medication costs, it's a different mentality. And it is a different attitude when you visit with them about the possibilities that you have to help them with their expenses. What it's going to do for the folks as well, obviously, it's going to provide access to the prescription drug coverage. If they don't have it in play now, it's a great way to kick it off and get it in play. It also protects the people from the Part D coverage gap, even though that's supposedly gone away. You still have folks with greater financial responsibility within that time period, and these programs can help there. We talked about how it can waive the late enrollment penalty for Part D if that's the case. That creation of the special election period through different times of the year, and by creating an application for this coverage, which can be handled, we'll talk about it in detail in just a second, quickly, it also triggers an application for those Medicare savings programs that can create even additional help for folks that you're visiting with. If you have someone that you know will qualify for or seemingly qualifies for the Medicare savings programs, sometimes it helps to expedite that process by helping them with that direct application, and because it cuts down the time on the qualification process. To be eligible for low income subsidy, a person must live in the United States, the 50 states or DC, and have Medicare Part A and or Part B, and they must meet certain financial criteria. The income test is based on the annual federal poverty levels. That's why the detail that we have today speaks to 2022. In the past, we used to see them updated, even into April. Now we're seeing it in February, early March, where the new numbers come out so we can be accurate moving forward. There's also, of course, a resource test, an assets test, certain things that they can have and still qualify. Some people are deemed eligible automatically because they have other needs-based programs. So if they have Medicaid or some other programs in place for the lower income individuals, they may already have it in play. And once a person's found eligible, they generally get that LIS coverage through the remainder of the year or until they have to requalify. Those levels are set by the government, the parameters that are put into play. And when we look at the parameters for 2022 versus 2021, and these have gone up once again for 2023, we can see how this out-of-pocket exposure can be, well, pretty expensive for folks that may have said, well, I'm going to take the cheapest Part D program out there, and they base it just on the premium of the plan and not the coverage. Can be a huge difference. Obviously, you all are aware of that. And we need to make certain then that we can help identify those people, because they may be the folks that have the standardized co-payments. And that is a telltale sign for us to say, hey, they probably got this in play. What you have with a multitude of the carriers now, too, is the fact that many of them have online or telephonic assistants to tell you if an individual qualifies for low income subsidy based on what records are available, and or if they've used a SEP or already have it in play, and at what level. A huge benefit for us. We also want to make certain that we're aware of the fact that there are benchmark premiums for plans that make a difference as to how these perform for us. So the government sets that benchmark, varies from state to state, and if a person selects a plan with a premium above that benchmark, they're liable for that difference. So if the benchmark is 32 bucks and they picked up a plan that's 34, they're going to be billed $2 a month for that plan. So we want to make certain that we look at not only the medications that are covered, the different pieces that come into play as to why one plan works better for an individual than another. We also want to make certain that we are aware of that benchmark, because otherwise we're going to have questions we're going to answer and people are going to go, I thought you said this was, and I get a bill for $2.30. Well, let's take care of that up front. It's also important to note that because low income subsidy has different levels of help, if a person is qualifying for partial extra help, that monthly premium won't be zero, but it will be reduced. So that makes a big difference too. And that's the population that's the near poor. And so that's the folks that, gee, do I even want to deal with that? Sure you do, because those are the folks that may have a bit of disposable income to purchase additional coverages for needs that they have outside of the base medical coverages. And as we mentioned, if that premium for the plan that is being selected for an LIS individual is above that benchmark, well, it's out of pocket. These benchmarks do change year to year, and they're different from state to state in many cases. And so we want to make certain that we have the details that are there available for us. And we see that the number of plans in 2022 dropped that were at or below the benchmark. So we need to be very fastidious in our research and make certain that what we're doing for our folks fits. We look at the drugs that they take, we look how often they take them, the strength of the medications, have they gone through different step therapies on their current plan to get that coverage. We want to make certain that we're doing things to help them, and that brings about the fact that in certain markets there's not a lot of plans necessarily that are below benchmark. It's also important for us to note that, and you hear this all the time in the news, it's infuriating in many circumstances, that many medications that have been out on the market for a long time, for a number of years, all of a sudden, well, there are new ways to use that drug or whatever it is. So we see prices change on medications within the program. And we also see some drugs that are being moved from one tier to another. So just because someone's medication is on the formulary, we need to do a little bit more digging, because if it's a generic drug that was tier 1 before and now it's tier 3 or 4, boy, that can make a difference. Not all generic medications are $4 or less. And we want to make certain that we're looking at all the possibilities of the financial ramifications of their choice. We also want to make certain that folks realize that this extra help program will help them with the premium cost of their plan and the deductibles that may be in a program that they have in play now, or ones that we help them with that better suit their needs, and it limits their co-payments. It's really important for us to make certain that folks realize that they're still in the same plan, or they're in a different plan that you've worked with them to enroll them in because it's a better choice, plain and simple. Well, this is how we're affecting some of those other costs. And if they access medications and the costs vary from this, above it, if it's lower, obviously they pay the lower price. But if they have challenges with that, we need to help intercede through the use of our customer service units with the programs that that person is enrolled in. Pardon me, had a frog jump in the throat. We talked about the annual election periods that we have in play and the special election periods here. As we are in the annual election period, this doesn't have as big a bearing as what we might see, but it does give us the opportunity to look at folks and say, okay, you need this help now here, and we can look at these assistance programs to help minimize your costs. So if we do that and utilize a SEP, a special election period, we need to realize that those plans become effective the first of the next month after that choice has been made. And it really, really helps the peace of mind of folks to realize that, hey, I kind of messed up and didn't enroll in time, and I got that little enrollment penalty and it's nagging at me. Well, it's going to take care of that for them. It's also really important to note that folks, if they don't examine their plans, as studies have shown the majority of them don't, they continue on the path that they've been on in the past for medication coverages, they're going to pay more without doing analysis. We want to make certain that they realize that that annual review is so important, simply because, well, their medications may have changed, the cost of the medications may have changed within the plan, how the plans cover that medication or not. You all probably have seen that as well, where, boy, I'm on this drug, it works well for me, and it's not covered by my plan anymore. We need to make certain that we look at and realize what we can do to help minimize those costs, even if they were to look at a program and say, hey, I'm just comfortable where I'm at. Well, this is going to help you with those costs. It's going to override those co-payments and co-insurance and help minimize those costs, even though some of those may be changing within the plan itself. I mentioned the fact that there are two levels of help, the partial and full help within the subsidies, and this is just based on income, plain and simple. As a person qualifies for full help, obviously, you're going to get the most out of the assistance program, but the partial help does help with premiums, coverage gap, and late enrollment fees. It also gives us the opportunity to make certain that they realize that if they're in one of those base programs and they're insistent on, hey, this is the best deal for me, I don't take any medications at all, so you don't have to do a review. I don't particularly care for that $480 deductible. My income is here. Well, we can cut the deductible, cut co-insurance. We can standardize some of their co-payments, free up dollars. And if we're not able to get a sale out of that activity, we have within our mindset, then within our fact finder, that, hey, we've saved them some money. They may then have cash or dollars available to purchase other programs outside of the healthcare arena. They might be looking at a cancer program. They might have a need for dental programs. They haven't covered their final expenses. There are a number of programs where that bit of discretional income can make a huge difference. And we can see, based on where they are against the federal poverty level, how it affects those costs for those individuals. The National Council on Aging does some wonderful things with these different pieces. Not available yet. These charts aren't yet available for 2023, but the 2022 ones are there for you. It's a great way for you then to have the resources without memorizing numbers. Some folks are pretty good at that. Some of us not so much. This gives us that opportunity then to have the chart from a third party that's not affiliated with an insurance company necessarily, to lay out the information, both for the mainlanders and for Alaska and Hawaii. These will be available to you through your marketer as well. How does someone apply for these coverages? Well, you can do it a couple different ways. You can do it online through the Social Security website, or through Benefits Checkup. And there are, of course, assistance programs set up with many of the carriers that we work with, the Medicare Advantage carriers, to take care of this. We can help them with this compliantly in their stead. And if we use an online application, it's available in English and Spanish. It accepts an electronic signature. The paper form, you can get it from the Social Security office or download it from the website. it really slows down the process. And much like everything else that we do in our business, everybody wants everything electronically because one, you don't have to worry about reading our handwriting. Two, can't be submitted without being complete. So some different things that can really speed up the process simply by doing some things electronically. And of course, you've got other resources out in the community that can help as well. I like to utilize them for information. I don't necessarily like to send people there because you lose control. That depends upon how you handle it with your agency, because if you're outsourcing it in a manner of speaking and you're sending someone to a ship center, you might not get them back. So something to consider there. Online, easier, faster, no verifying documents are needed. The Social Security Administration is going to use federal records to verify the answers. If you use a paper form and it's incomplete, Social Security will follow up with phone with the applicant eventually. Online applications can't be submitted till complete. I mentioned that. So that's a great way of making certain we've done everything that we need to do. And instruction sheets, they're available in 15 languages on the Social Security website. So language can be a bit of a challenge, but there are help programs out there to deal with that as well. That's how the applications look online versus paper. I usually keep paper applications with me simply because I can gather that information and submit it later if that's necessary, depending upon the scheduling that we have or the time that the person has to spend with me, because it does take a little bit more than to enter it in. You can do it electronically with them on your laptop right at their house. But sometimes I've only got an hour. Well, get the information and we can take care of it afterwards. They, being the applicant, they receive a notice of approval or denial within a couple of weeks. And there are additional reference materials that you have that are available to you for your comfort level and knowing all of this information and making certain that the folks that you visit with realize that, hey, I can go and verify this as well. It really makes you a stand-up type of folk. Same thing, there's a ton of information out there with different sites. And this is a piece that you can actually use with the public. This is from the National Council on Aging. It speaks to, in this circumstance, a low income subsidy presentation that you can modify to a degree with your contact information. And there's one for MSPs as well for the Medicare Savings Programs. All we've done so far is hear John rattle on about LIS. We haven't talked really about some numbers. We kind of breeze through them, but how do we talk about them? How do we make certain that we do what we need to do? Well, with the Medicare Savings Programs, there's information available online as well. There's a bunch of different ways of discerning in my market what is a program called. And we realize too that over a quarter of the folks that are in Medicare Advantage plans, well, they receive LIS, and we need to speak to them on an ongoing basis for our other folks because there may be other people that qualify for this in an MA plan and they don't have it in play. So how do we make it work? We got the other tools that can work there as well. I want to make certain before we go into why you want to do this with Premier that you see the presentation itself for the Medicare Savings Plans. So I don't have this in reader view like we do with the regular presentation we've been going through. So I want you to see some of the slides there on the side. But this gives you information then that you can personalize. This has got the mug of John Dubas on it with his contact information. Obviously, utilizing this program, you'd want your information on there, and you can use this virtually or live. Remember, there's one of these for low income subsidy as well. And it goes through and it speaks to what are Medicare savings programs. And it makes folks realize that these programs are administered by the Medicaid program in conjunction with the state, and they help cover not drug costs, but the Medicare premiums and the cost sharing for those with Medicare who have limited income and assets and don't qualify for full Medicaid. As I mentioned before, they may be known as something different in different states, and this really helps people then realize that I can get additional help beyond the cost of my medications. There are different levels of assistance. The QMBs, the qualified Medicare beneficiaries, and these are folks that are at 100% of federal poverty level. They're going to get help with the cost of A premium, Part A premium if applicable, a Part B premium that's in play, and help pay for those A and B deductibles and co-payments after the coinsurance. An important level for us if we're active in the dual special needs programs, because in most circumstances, the vast majority of circumstances, the carriers out there with a dual special needs plan need this type of assistance in order to maximize the benefit of that DSNP. And so that is a key function for us in this area. You also have a couple of other areas or levels of assistance that we run into, and these are the specified low income beneficiaries, the SLIMBs. This program only pays the Part B premium, as does the qualified individual as well. So you have one program here that pays the premiums for the Part A and Part B if applicable, and helps with the cost. And then you've got a couple of premiums or a couple of programs that pay premium only. What's the difference for that? Well, if you look at the income levels of these people and what that Part B premium is, and you free up that resource, you've done a great service for that individual. And once again, they have discretionary funds to cover other needs they may have as well. There is also an additional QDWI program. It's different than the other MSPs, and it's for people that are under the age of 65, went back to work, lost their premium Part A program. In the many years that I have been working in this area, I've run across one of those in probably 20 years. So this is information that is necessary to know. You probably won't run across it too terribly much. And much like with these other categories and the specifics with them, the recording of this is available on our website and on our YouTube channel to address a question that popped up. So these programs take care of the Part B late program enrollment penalty as well. So much like the low income subsidy took care of that 1% per month, this can help take care of that 10% per year premium someone has if they enrolled in a Part B late. And it takes dollars out of the realm of the state recovery. So when we look at this and people speak of Medicaid, and a lot of times they'll look at Medicare, Medicaid, and going into a long-term care facility, different animal, different requirements, different ways of doing things. When someone goes into a long-term care facility, there is a possibility of a state recovery. Within these programs, there is not. And keep in mind, if someone does qualify for one of these assistance programs, they automatically get that help with their medications as well, that deemed eligible category. It is a program that has government organizations working together. So you have the federal government and the states doing different things to work and help these programs pay. The state Medicaid agencies, however, can vary some of the requirements that a person has to satisfy in order to enroll or to have these programs. So it can vary from state to state, and that's important for us to note. For someone to qualify for these, they got to have Medicare Part A. They got to meet those income and assets tests. The financial eligibility guidelines are set by law, but the states can vary them. And you'll see that certain states do not have that assets test. And that can make a difference for you if you run across someone that moves to your state where there is an assets test from another one that didn't. They may qualify in their old residence, but not in their new one. That doesn't happen all that often, but it does. And I've actually run across those a few times in my career. Eligibility is generally redetermined each year, so it's something they go through each and every year. It's not necessarily resubmitting an application, but the agencies may reach out for additional detail. This is where we come into some of the nitty gritty. And I'm certain some of you are finally saying, well, gee, John, you talk about income levels and assets tests. What the heck are they? Well, for the different levels, here's what we've got. You don't run into Alaska and Hawaii too terribly much, unless you live in one of those states, I guess. Not a lot of marketing pressure in those states. But if you look at the other 48 states and DC, you see a bit of a marriage penalty, in a manner of speaking. In order for someone to qualify, their income has to be at or below 100% of federal poverty level, 115% of federal poverty level, 125% of federal poverty level. The resource levels are the same across the board. And that resource level excludes a house and a car and some other things as well, but those are the big ones that come into play. So generally, when you're visiting with folks and you're doing a fact finder, you're basically asking, well, as a couple, is your income less than $19,000 a year? If so, there might be programs that we can help you with that can fully subsidize some of your costs here, or go with the highest number, which is probably more seemly. We're looking at basically on 2022 numbers, $24,000 a year. And if a couple has an income below that and they pass the assets test, we can help them apply for these coverages and see how some things will work for them. Bear with me, I had a question pop up. I'll address that in just a moment. But this is a sheet then that particularly this area right in here, these 6 columns, well, whatever, 8, it gives you then a piece that you can have in your presentation book or in your mind or on your computer, however you want to do it, that gives you those limits that you can speak to in generalities. And folks will tell you, well, my Social Security check is this. That's the only income I have coming in. Keep in mind that Social Security check is net, not gross, because it's taking the Part B premium out of it in most cases. So we got to do a little bit of math and make certain we have the right numbers. But this can make the difference then as to how someone qualifies or not. And this is something that you can address at the point of presentation, your initial presentation, or on a follow-up appointment. So that's where I was mentioning where it helps us manage our time. We can go through and address as many people as possible. We can create a list of folks that may qualify for additional help, and we can handle them one of 2 ways: as quickly as possible during the presentation or immediately thereafter, or schedule them down the road. We mentioned, of course, that once you have MSP, it's going to deem you for the LIS, and it's important for those that know that the government has different things that can help trigger different programs to come into play. We talked about, boy, if someone qualifies for LIS, it's going to trigger that MSP application. And the government's regulations tell us that the state Medicaid agencies have 45 days to determine MSP eligibility. Some of the challenges that are going on in today's world, that may be stretched just a little bit, but that's the timeline that they generally give us. If you are one of those individuals that are active in the Medigap market, well, if someone has an MSP, do they need a Medigap policy? Well, it depends on the level of assistance. If they're QMB or full Medicaid, you don't touch them with a Medigap policy. If they're SLMB or QI, well, that might be someone that really wants a Med Sup, have had challenges affording it, since those programs pay just the Part D, or the Part B premium. Those might be the dollars that make the difference as to whether or not they can afford a Med Sup or not. So some things that we need to come into play. It is important to note that if someone has QMB, they can suspend their Medigap policy for up to 2 years, because that may drop off. And we need to make certain that we're aware of the ramifications of helping people with a Med Sup with an MSP. If they're a qualified Medicare beneficiary, don't do it, plain and simple. The other two, it may be possible, but keep in mind it's a stretch on the budget for some of the Medicare supplement plans for an older individual that can make a huge difference. And that's important for us to realize that these programs too, much like what you see with long-term care programs, if there's a spend down that's involved, you might have some challenges there. We're going to put it that way. And it's different for those getting long-term care Medicaid. This is how someone can do an application for a Medicare Savings Plan online. It really can make a big difference. because once again, you can go through as a, oh gee, the word I'm looking for? You can help the beneficiary with these as their applicant completer. That's a terrible way of putting it. But it then gives you then the opportunity to go through and speak to different requirements. So you have them as part of your fact finder and help deal with some of the language issues that may come into play. So yeah, someone that goes on a QMB program and there's a balance billing challenge, you got a problem with the state and the company, that let them flesh it out, and making the carrier aware of that you've enrolled an individual on because of the QMB. They'll take care of it for you. Knowing these rules and knowing just to mention them can make a huge difference, because if you do this, think of the financial ramifications, positive financial ramifications you're doing for that household. It's freeing up dollars for them where they all of a sudden may have enough budget to make it through the month. Sometimes more month than money. Well, this can make a difference there too. It also gives you the opportunity to speak to these folks about referrals, not only with other people, but for organizations that they visit with. So maybe they're going to a senior center or a nutrition site or someplace, and they have speakers periodically. This may be your in for those individuals and utilizing an approach such as this. So it gives you then all the information that you need to speak to this program. What's a Medicare Savings Program? What's a 101 on these programs? And this is available also for the low income subsidy folks. Why do you want to do all that with us here at Premier? Well, we can help you in a number of different fashions. One of them is simplifying some of your contracting, doing some things electronically, setting up a profile. Insure LC can help you pick up multiple carriers with a click and make it simple, autofill for you. It's also a great way for you then to diversify your portfolio when we look at some of those ancillary programs. Gee, there are 4 dental programs. I know I need 2 of them. This is a quick way to do it. We do offer discounted E&O for qualified agents. What makes you a qualified agent? Well, you got a contract with us. But this is a program you own. It's not being added to a blanket E&O policy for one program and that's it. This satisfies that requirement that the insurance companies have with you in order to contract, and it covers you with whomever you contract through. We're a large organization. We have a big old portfolio. We don't have every carrier in the world. I don't know of anybody that does. And there are, of course, carriers out there that don't contract through an upline. Not very many of them, but they are there. This gives you the opportunity to own your coverage and take care of you regardless of whom you contract through. We also offer discounted continuing education programs through our association with WebCE. Keep your license in play. You can add to your own benefit package too through a modified guarantee issue disability income program, in which you're paid a commission on yourself too to help grow your own benefit package. I mentioned a few times that today's presentation is being recorded. It will be made available to you on our website at premiersmi.com in resources and on our YouTube channel as well. Past programs have been in there as well. I keep talking about, well, gee, this would make a great presentation. Well, how do I do that, John? How do I get into churches? How do I get into grassroots marketing with different centers of influence in the community? There are programs on there that are recorded and refreshed on a regular basis. So they're there for you to use 24/7. We do also offer a program that I cannot overemphasize the value of, and that's our Medicare Center program that's available without cost to an agent contracted with us. Okay, to use JJ Walker's term off that bloody commercial, it's free. You don't have to pay anything for it. It gives you an opportunity to offer side-by-side plan comparisons after you've collected that scope of appointment through multiple methods. You can do it, and it stores it for that 10-year period, and it has that call recording function and storage capability as well. So it can take care of a lot of the compliance components that you have to satisfy when you deal with the Medicare population. It also gives you a Pearl. What's that, John? Well, most folks know that's a personal URL, and it's a microsite that comes with this. So it gives you a presence on that lovely World Wide Web. There are also programs in there that will help you realize that some of your folks may be vulnerable to a switch. So those are the folks that we can then prioritize and do an annual review to make certain that if they do change coverage, it's with you, it's with us. We keep them in the book and we satisfy the needs of our people. It does also have a lead center available within it where you can sign up for both written leads and live transfers, where you can turn it on or off at minimal cost. That detail is available to you through your marketer as well. And there are other resources within that that help you with the sales process, different talking points, sales scripts, different things that you can use to better yourself and your skill set in dealing with our target population. And it is available as a mobile application as well. All available at no cost to you as a contracted agent. We also want to make certain that you realize the full value of your services and how you are compensated. So there's a page on our website that speaks to the carrier incentives. Doesn't come into play with Medicare Advantage and PDP programs because the government sets the max comp on those. Most carriers follow with that. That's what they pay out. But it can make a difference with MedSup or PDP, or not PDP, MedSup or DVH, dental vision hearing programs, final expense, life insurance, other programs. They may help you qualify for carrier trips and incentive programs we offer as well. We want to help put you in front of folks, so we do contact lists made available to you, butted up against do not call at discounted prices or no cost to you, depending upon your contracting relationship with us. And I mentioned those programs we have to help you grassroots market, maximize the value of working in a retail opportunity, working with churches, mosques, synagogues, working with providers, be they doctors or dentists or whomever. There are carriers that generate prospects for us as well. Those are the folks that you work with on an ongoing basis. Much of that is controlled by a local sales manager. So you want that relationship to come into play. We do offer internet leads, direct mail support, a T65 locator, and a great referral program to remind you on how to take one lead and make it grow into many. Great way of doing it. That lead program for direct mail is based on production, drives down that cost. You can qualify two different ways. You qualify twice in a month if you want to, based on production, on health programs, and on final expense. We offer these programs through preferred lead vendors because we vet their systems. We vet the information that's going out to make certain that we all stay in compliance. We do also have direct mail leads that have come back that are fresh, haven't been touched. You can buy those one-off, however many you want, based on a particular area, what is available. It is dictated by supply and demand, so these costs can vary from area to area, time of year to time of year. Great way to fill in your calendar, however, utilizing people that have raised their hand saying, I want some information. That lead center program that I mentioned on Medicare Center, very economical to use, all part of your CRM within that system, that database to help you manage your folks, but grow it as well. And it gives you then the ability to turn it on or off, depending upon when you're ready and when you want to use it. Great way for you to choose lead types and sources based on your unique business. The Facebook leads, or the internet leads of Facebook, there are programs for final expense and Medicare. One thing about social media leads, they pop on pretty quick. They'll pop off pretty quick too, because they're probably replying to multiple people. So you need a quick reply with those. At T65 locator, it's a program you download to your smartphone or your desktop. You register for it. They verify that you have a contract with us. Available to you then, once again, JJ Walker style, free, and enables you to locate people based on different parameters as to where they live. A great way if you're in the field and an appointment cancels, you got another one in that same area. You don't want to drive all the way here or whatever. Can I door knock for dental programs? Great way to add to book business. And start building that funnel of T65 folks. That referral program reminds us of how to ask for referrals and make certain that we extend it not just to the people we're visiting with in a sales circumstance, if we sell them or not, they can refer, but also a great way to keep our book of business engaged and take care of the folks that are so very important to us. We do all this because we want your business. We want to be referable to you. We want you to feel comfortable with the systems we have in play and realize the value that they can bring to you and your agency. And they're pretty simple to put into play quickly. When we talk about low income subsidy and Medicare savings plans, this can be part of your marketing plan immediately. It does require a little bit of study in order to make certain we know how to utilize the programs, but it's something that you can do now. We're in AEP now. We got people out there that may be talking about this, and you can't figure out, well, how can they offer that PDP program, because those aren't the copays that are on the net. Well, gee, maybe they're using low income subsidy. You can turn that situation around and do the same thing to help your book of business prosper. All this said and done, I'm going to check really quick for questions. I know this has a ton of numbers that are involved in certain places here. Someone speaking about Medicare Advantage, brother on disability before he went to prison. He's recently released. Went Social Security, restarted social. He set up a phone appointment for the second week of November. Currently has no insurance, disabled. What can we do? Well, in the meantime, Pamela, it's pretty tough, plain and simple. You got to have those base coverages in play for any of these assistance programs. There may be some short-term medical programs that can come into play. I'll guarantee you they probably won't be inexpensive. We'll put it that way. And if he's just coming out of incarceration, I may not have a lot of funds available. There's not really a lot you can do about speeding up the process with Social Security because of the pandemic and the scheduling and everyone else. Good help is hard to find. It's just a couple of gotta grin and bear it to a degree there, I'm afraid. So that said, I think I've got all the other questions covered. At this point in time, I want to thank you for coming on with us today. If you've done business with us at Premier, I thank you for that business. I thank you for the opportunity to grow that business. If this is your first exposure to us, or if you haven't done business with us in the past, I welcome the opportunity to do so, and thank you for that. But particularly, I want to thank you for your time. It's your most valuable resource. I know you're in a hectic selling season now. This, however, I think one of the reasons we scheduled this even now is it can make a difference for you in your business during the annual election period, prep you through the end of the year, put you in a good stead for 2023. So all that said and done, I'm 4 minutes over. I apologize. But hopefully you will see some of the value that you've gotten out of today's program, and that these resources are available to you through your marketers. I'll make certain that they have that information by the end of the day. And of course, you can reach out to me, and I'll make certain that you have it as well. So all that said and done, until we are able to visit again, I wish you good selling. Thanks so very much.